Hi everybody, Dr. Ahles here. In this short video, we're going to talk about the three kinds of chemical buffering systems that your body uses to ensure that you stay in that correct normal pH range of 7.35 to 7.45. When we talk about chemical buffers, the first solution that we're going to talk about is the bicarbonate buffer system. This is something that is used in extracellular fluids, and I know I already gave it to you in bold, but underline, highlight, star. This is used in extracellular fluids. We'll have a different one for intracellular fluids. When we talk about the bicarbonate buffering system, there are two elements to this system that we're bouncing between. Either bicarbonate, as we see here, HCO3, or carbonic acid, H2CO3. When we talk about buffering systems, remember that with a buffer, it's what gives us this arrow that looks funky here. So when I need to, I can shift more toward carbonic acid, or when I need to, I can shift more toward bicarbonate. So this buffering system is going to allow me to absorb some of the pH changes by going between these two compounds. So let's start with bicarbonate over here on the right. The goal of bicarbonate is to neutralize strong acids that enter the bloodstream. So anything that would insert hydrogen ions into your bloodstream, that's something that bicarbonate is going to deal with. So the way that bicarbonate works is it attaches to those hydrogen ions that are present in the bloodstream from those acidic compounds. It's going to generate that carbonic acid that we talked about. Carbonic acid is a weak acid. So if we hadn't have dealt with those hydrogen ions from the strong acid, we would have seen a huge change in our pH. But by building carbonic acid instead, our pH change is a lot smaller and it has less of an impact on the body. So when we're considering how it works with an acid coming into play, that bicarbonate ion absorbs the ions, the H plus ions, generates something that's weakly acidic instead of very strong and acidic. We constantly reabsorb bicarbonate using our kidneys, and as we'll talk about a little more with renal buffering, remember that we have this alkaline reserve, meaning we're constantly making sure that we have enough bicarbonate ions circulating in our bloodstream. So bicarbonate, a chemical buffer that we use for strong acids. The flip side of that then is carbonic acid, and this is our buffer that we use to deal with strong bases. So strong bases are things that either steal hydrogen ions or they bring an OH group into your solution. Carbonic acid, because it has two hydrogen ions, is actually able to give away one of those hydrogen ions to that strongly basic compound. By doing that, it becomes bicarbonate, but bicarbonate comparatively is a lot weaker of a base than something like hydroxide. So just like we saw with bicarbonate and our strong acids, we will see a pH change. We do get a little more basic, but not nearly as basic as we would have gotten with that strong base. So carbonic acid becomes bicarbonate, it becomes more basic, but not as basic as we would have seen with the strong base. When we think about where carbonic acid comes from, the nice thing about this is we have an unlimited supply. Your tissues are constantly making carbon dioxide when you break down your glucose. And when we have that extra carbon dioxide, notice we've got another double arrow here. The more carbon dioxide I have, the more carbonic acid I can make. So I have an unlimited supply of carbonic acid. My kidneys are really good at keeping the amount of bicarbonate I need present. That's going to be how my bicarbonate buffering system works. And again, remember, this is what I use in extracellular fluids, like plasma, like my interstitial fluid. The equivalent that I have to the bicarbonate system for intracellular fluid is the phosphate buffering system. So this is going to work very similar to how the bicarbonate buffering system works. In this system, we're going to use something called hydrogen phosphate, so HPO4, and dihydrogen phosphate, H2PO4. So we can see those two components here, HPO4 and H2PO4. When we're considering who does what, hydrogen phosphate, the one that just has one H, is what we use to neutralize strong acids. So this is going to be very similar to bicarbonate, like we saw in our previous buffering system. So hydrogen phosphate, 1H, PO4, is going to attach to the hydrogen ions that come from a strong acid. When it attaches to those hydrogen ions, it forms dihydrogen phosphate. Dihydrogen phosphate is weakly acidic, so instead of changing the pH dramatically, making it very acidic, this just makes it a little bit acidic. And that dihydrogen phosphate is also something that we can use to neutralize strong bases. So just like we saw with our carbonic acid in the previous buffering system, dihydrogen phosphate gives away a hydrogen ion, and when it gives away that ion, it turns back to hydrogen phosphate. Hydrogen phosphate, a weak acid, going to have less of an effect on pH than that strong acid would have done. So our two chemical buffering systems so far, inside the cell, phosphate buffering, outside the cell, carbonic acid and bicarbonate buffering. Let's talk about a buffering system that's used both inside cells and outside cells. And I want you to underline, highlight, star that. Intracellular and extracellular. The most important buffering system that you actually have in your body is this protein buffering system. And the protein buffering system is used to buffer fluids inside and outside your cells. The reason we can use proteins as a buffer is because they are amphoteric. And all this fancy amphoteric word means is that our proteins have the ability to function either like an acid or like a base. Like we had bicarbonate and carbonic acid, or hydrogen phosphate and dihydrogen phosphate, our proteins have the ability at the same time to be either of those things. So when we look at an amino acid, that's something that we use to build our proteins. There are kind of two main parts of it that we're going to steal from or add to, depending on the chemical conditions of our solution. If we are in a basic solution, so the pH is too high, we can use the part of our amino acid called the carboxylic acid. So this structure right here on the right, the carboxylic acid can give away its hydrogen ion. When it gives away its hydrogen ion, this is going to help to lower the pH. It's going to make the solution more acidic. And check this out, it's called carboxylic acid. So when it releases that hydrogen, it's acting acidic to help neutralize a basic solution. And we can use the amine group to do the opposite function. So my amine group that I see over here is NH2, but when I'm in a solution that has a whole lot of hydrogen ions, when my pH is really low, I can actually attach an extra H plus ion to that amine group. So I can either absorb or bind two hydrogens with the amine group, or I can release hydrogens with that carboxylic acid group. That's what we mean by saying that our proteins are amphoteric. They can do either of those things to help buffer the body. And consider, we said this is the most important buffering system. That's why, because these amino acids can go either way when we're talking about their function. So a picture that summarizes for us the two intracellular buffering systems. I thought this was pretty clear for us here. When we're in acidosis, meaning we have high levels of hydrogen outside the cell in our extracellular fluids, those hydrogen ions enter our cell and threaten to make our cell become very acidic as well. So as those hydrogen ions come in, either my hydrogen phosphate buffering chemical or my proteins have the ability to absorb those hydrogens. So I can generate a protein that has that extra hydrogen attached to it, or I can generate my dihydrogen phosphate. Both of these can hold on to that hydrogen for me and ensure that my pH doesn't drop like it normally would have if all of these hydrogens continue to accumulate. The most important protein that we see inside cells that does this kind of buffering is hemoglobin. So hemoglobin is very important in regulating your blood pH because it has the ability to absorb all of these extra hydrogens. And remember, we can use this buffering system in alkalosis situations as well, meaning I don't have enough hydrogens outside of my cell. In that case, we're going to start losing hydrogens or sending those hydrogens out of the cell. If I need to keep sending hydrogens out of my cell, I need to have a place where I can get them from. And that's those proteins that have the extra hydrogen, or that's that dihydrogen phosphate. As they give away those proteins, they help to those protons, those H plus ions, they're going to stabilize the pH in the cell and not allow it to suddenly get very, very high. But a quick reminder for us, protein buffers are used inside the cell and outside the cell. So keep in mind, while this picture is only showing us the proteins inside the cell, we do the exact same thing with the fluids that we find here on the outside. So let's wrap it up. We have 3 different chemical buffering systems inside the body. Those buffering systems exist to either absorb extra hydrogen ions if we're very acidic, or release extra hydrogen ions if we're very basic. Chemical buffers are great because they're using things that are already present. We don't have to build them, we don't have to absorb them, they're already there. We see chemical buffers constantly working in the background. They're constantly shuffling between their acidic and basic forms inside our body. But here's the challenge with chemical buffers, and here's why we need some of these other systems we're getting ready to talk about. Chemical buffers don't have a way to eliminate any extra hydrogen ions that they're absorbing. So in the case of metabolism, where we're generating a whole lot of extra hydrogen ions, at the end of the day, chemical buffers can try to offset the challenges those pose. But at some point, if I don't have a way to get rid of the extra hydrogen ions, I am still going to see an effect on my body's pH. So chemical buffers, a great first line of defense, both to help me in intracellular fluid, ICF, or extracellular fluid, especially those protein buffering systems. But as we move on to talk about our 2 other types of buffers, keep in mind this is my biggest challenge with the chemical buffers. They can kind of hide the mess, but they can't actually deal with it.